Hi all, I'm Dr. Beth Stuart. I'm an Associate Professor of Medical Statistics at the University of Southampton, and I recently led a study that was a systematic review and network meta-analysis of topical preparations for mild to moderate acne. So why did we do this study? Well, acne is really common, and the first-line treatment is usually a topical treatment. Now, patients and clinicians may have a feeling for which one of those topical therapies they think is the most effective, but actually, when you look at the literature, there aren't very many head-to-head comparisons of the different treatments that are out there. So, how do we go about it? Well, the first thing that we did was we talked to patients and we tried to understand when patients talk about something being effective, what does that mean to them? And they were very clear that what they meant was that they were reporting that their acne had improved, not a clinician. So a patient-reported outcome was really important to them, and we chose a patient global assessment of the acne as our primary outcome for the review. We also looked at withdrawal or having to discontinue the study medication due to adverse events, the investigator's global assessment, and total lesion counts. We found 40 papers reporting on just over 18,000 patients, which had sufficient data from meta-analysis. One of the things that we did find was that we were only including mild to moderate acne, and many papers weren't very good at reporting the severity of the acne and had to be excluded. Many studies were at high risk of bias in at least one of the domains that we looked at, and the overall certainty of the evidence assessed with the Cinema tool for network meta-analysis was low. We found 11 trials on just under 7,000 participants that looked at the participant global assessment of acne as either improved or much improved. These comparisons showed that adapalene plus benzoyl peroxide was significantly more effective than any of the other treatments that we considered, with the exception of clindamycin plus BPO, where that difference was not statistically significant. There were similar patterns for the 24 studies that looked at total lesion counts and the 14 studies that considered the investigator global assessment. In all of those comparisons, adapalene plus benzoyl peroxide was the most effective. 35 studies looked at withdrawal or discontinuation of the study medication. That was actually really quite rare in all of the trials that we included. However, it did seem to be more common with adapalene plus BPO than it did with either adapalene alone or BPO alone, or indeed any of the other treatments. So overall, although patients wanted a patient-reported outcome, this wasn't very common. And it was actually quite difficult to meta-analyze many of the outcomes that were included because reporting wasn't consistent. So work to harmonize outcome measures and to create a core outcome set in acne is actually really important if we want to be able to compare treatments going forward. And in terms of the treatments we were able to compare, adapalene plus benzoyl peroxide seemed to be the most effective, but it also had a higher rate of discontinuation. There wasn't much to choose between the other treatments, and there didn't seem to be any real advantage to using a topical antibiotic, and that may be important when we think about antibiotic resistance rates. So we hope this study helps the patients and clinicians have more useful conversations about which topical treatments may be effective and acceptable in consultations. Thanks very much. We hope you enjoy the paper.